We live in an unequal world. The current COVID-19 pandemic has highlighted and worsened inequalities within and across countries. One of the most crucial inequalities appears in the distribution of vaccines. Worldwide, more than 5 billion vaccine doses have been administered, but they have not been distributed equally. Over 80% of people in higher income countries have received at least one dose. In low income countries, only around 2% of the population have been jabbed. But why does this unequal distribution of vaccines matter, and how does it affect people in countries without good access to vaccines? Vaccines have been essential in protecting humans from COVID-19. With the vaccine, there's a lower chance that you'll get infected and develop severe symptoms. And if you get infected despite being fully vaccinated, you are at least 10 times less likely to be admitted to a hospital than if you were not vaccinated. And vaccinated people who get the virus are a lot less likely to spread it. If we vaccinate enough people, herd immunity allows us to reopen schools, restart the economy, and resume full healthcare services. In the UK, the vaccine rollout allowed life to go almost back to normal for many months. Unfortunately, many lower-income countries have had little access to vaccines. Due to prolonged COVID outbreaks, 256 million people in Ethiopia, Malawi, Uganda, and Nigeria have lost vital income sources during the pandemic. 40 million people have suffered from severe hunger, primarily due to the pandemic, and access to basic healthcare has been severely disrupted. For example, diagnoses of treatable tuberculosis have decreased by 60% globally during the early stages of the pandemic. Not being able to vaccinate a large enough part of the population can cause a range of humanitarian crises. Hospitals and clinics are overwhelmed, and healthcare systems break down. More people suffer from severe respiratory problems, and more people die. Due to lockdown measures, people lose their jobs and suffer financially. In some regions, large parts of the population starve for long periods of time. Schools and universities are closed, and remote learning is often not feasible due to a lack of resources. This affects both children who suffer mentally and academically, and parents who now need to supervise their children alongside work and other commitments. These kinds of issues have also plagued the UK. However, poorer countries have fewer financial and economic resources and less robust healthcare systems, so the effects of the pandemic are felt much more strongly here, particularly by the poorest citizens. Sharing vaccines with these countries can mitigate these crises. For instance, a vaccine can prevent a nurse from getting infected and needing to self-isolate. In turn, the healthcare system can work better. A vaccine can save a parent from falling ill so that they can continue to provide for their family. Vaccines can allow students to return to schools and universities and enable them to receive the education they urgently need for a better future.